Hello, beautiful people out there. My name is Margarita. It's my very first YouTube video. I have never made one of these before, so it's going to be a learning curve for me. My journey out of the anti-cancer industry. See the road behind me. That is my journey back. My journey back to health. I cannot tell you what I've been through in the last 5 months, although I will try over a series of videos. I'll keep this one hopefully brief, 10 minutes or so. It is something you've got to know about, and I'm trying to set up these sort of educational tutorials, something to get the word out there that you are being lied to by the multi-billion-dollar cancer industry, that they call your health medical professionals treating you conventionally. And in my case, it's Princess Margaret Hospital. Princess Margaret Hospital, who give away million-dollar prizes. They have lotteries. They get billions of dollars per year for research. And I have become trapped to that. This is what I've become prey to, this kind of trap. I really have to let you know what's going on. When I was first diagnosed 5 months ago, whatever it was, late diagnosis or early, I don't care. I have a tumor in my stomach. It's called gastric, CA. Whatever name they want to give it, that's fine. I've been following Dr. Morse's videos more recently now, and I am getting myself out. I have gotten myself out, and very surely and slowly are getting myself detoxed. It has been a long, long road getting here. I have had blood work up the yin-yang, I mean, way into my veins, both of them. I got a bruise here from blood work that will never go away. You think it's a birthmark? That's a bruise right there. So it is crazy. It is crazy what people are telling you, what nurses are telling you, what doctors are telling you, oncologists are telling you, radiologists are telling you. Oh, clinical trial coordinators are telling you, oncology nurses are telling you. I cannot tell you how many people were on my team supporting me, or as they said, they were supporting me and supposed to have been on my side. Now, the protocol you need to follow. You need to follow a certain protocol. You need to follow XYZ. You need to follow chemo, radiation, surgery, chemo. It would always go in the same flow. And especially for my kind of particular cancer, whatever tumor that they wanted to, blow out of proportion and make you use a fear factor. The fear factor is enormous. The way they try to scare the shit out of you is it's unbelievable. Everyone fell for it. I fell for it. My partner fell for it. My whole family fell for it. We are going to go down that road. We got to get you fixed. We got to get you cured. We got to go through the route that they prescribe for you. And don't sway from the path, because they're going to lead you to cure or remission or whatever it is they think A clinical trial, number one, is something that they have no data on, and no evidence has actually been taken and evaluated and sorted through and given out as a percentage of survival. You're part of a clinical trial. You are actually going to be part of their data. You're not actually going to get a cure. They're going to say, these are your chances. This is your 20-year prognosis post-trial, that you may or may not get this again in 20 years. What? Holy shit. And thank you very much for, why am I going through this kind of hell? And I mean hell. I mean, I've had, it's a lovely little thing called a portacath. Oh, a lovely little thing where they put a tube running into your aorta. Oh, it's beautiful. There it is. There's the portacath. It's leading to your heart. I'm trying to get this out right now. This is 3 months later, and look at that. There's the tube. There's the portacath. I want to get a close up. It's disgusting. I personally never like looking at it. I don't want anyone touching it. I don't want myself touching it. It's a procedure that they lightly put into a brochure about how you get it, what it is, how to prepare for it, why you need it. Oh, the beautiful things that you need for blood work too. And every once a month you have to get it flushed. So no matter what you get done, chemo, blood work, or anything, you always have to go back for a flushing. So they have to poke it, and you get that same bruising and pain all over again. And I'm trying to get that removed for that one reason. There are many reasons. And look at all the things you can expect. That things could go wrong. A fever with or without chills. Shortness of breath. Chest pain. Why? Because it's going into your bloody heart. These chemicals and drugs are going into your heart, into your aorta, through your heart vein. It's amazing. Pain, swelling, redness, drainage fluid around your incision. Oh, lovely. Swelling on your neck, which I do have. Any fresh bleeding can come through. It's just a lovely series of symptoms that you could have from getting a port inserted into a large blood vessel leading to your heart. Literally, that's exactly what it says. I'm just reading it. So I went through that procedure, lovely little 3 hours, 2 weeks of a week and a half of recovering from that procedure, which they downplay. Oh yeah, you can have chemo the very next day after getting this portacath, inserted. I seriously doubted that. Carrying around a lovely thermometer. Yeah, every day by the bedside, in the kitchen, in the living room, wherever I am. I have to take this temperature of mine. Not anymore. 3-4 times a day, because there was such a fear of this fever coming on. That's even before chemo. So don't worry, there's better or worse, tortures that they can come back with, following the portacath being inserted. They're going to put you on a chair. And, well, never mind the blood work. They do take the blood work, to see if you're eligible for chemo. Then you're waiting and waiting and waiting for a whole day, practically 5 hours. You're sitting there waiting for your toxic, biohazardous waste to be mixed in the pharmacy. You're sitting in a chair for another 5 hours with 3 or 4 drugs coming through the port. It's totally disgusting. And having another bag of toxic biohazardous waste, biohazardous toxins taken home with you in a bag while you're connected to a tube in your chest. They were just like, lackadaisically, no problem, just go home with the bag and you come back tomorrow and get it removed. Like, we don't feel the pain or the suffering. I have to take this home with me. What could happen to you medically if there's an emergency? Again, with this, every time I brought this bag home, I had a spike of fever. Every time. And second time I had it done, because there were 3 cycles. Second time I actually went up to a fever of 92 degrees. 3 in the morning. Brushed ourselves down to the emergency hospital and got myself in, immediately looked after. I've never had such quick emergency care. I never had this much, I never have to wait. I'm in the emergency room and I'm in getting a doctor's care immediately in the emergency section of the hospital. Just crazy how they looked at me right away and took care of the matter, because I'm a chemo patient. I have a bag attached to my chest. Just to bring the fever down, and even with the extra precaution of keeping me an extra night in a semi-private room. Yeah, so look forward to those lovely pleasures of having to have a hospital stay, where they don't feed you anything healthy. They fed me a boiled egg. They had cereal with milk. Dairy. Dairy, the most mucus-forming foods you can put in your body. I went vegan for that reason. And also, egg. Reading about it, you'll see tumors love eating eggs. That is a cancer-feeding food. I was getting some kind of weird pastry with trans fats and some weird chickpeas cooked inside. Again, proteins are also very acid form. Watching Dr. Robert Morse. Acidosis is a big, huge cause of cancers. Cancers, tumors, lesions, other health problems that you'll learn about. This is what they're feeding you in a hospital setting. Not to mention Princess Margaret Hospital has a Druxy's deli on the main floor and a Tim Hortons, which is donuts, coffee, fatty pastries, cookies, sugars, another cancer-feeding food. They love it. Sugar is also a problem for acidosis in your entire body. So, unbelievable kinds of emergency and health care in our hospitals. I'm sure all around this whole country, probably U.S. as well. I'm hearing some sad stories. So listen up. We got more things coming up. I will be talking to you more about each and every cycle I had, what happened post that. Oh, radiation. Radiation is another lovely pleasure. Radiation while taking oral chemo. So I'm going to tell you this in the next video. I'm trying to keep this one short and let you know exactly what my experiences were, what to avoid, how to stop, what to replace it with. I've got my grape juice diet here. I've got my raw food diet over there. Fruits, raw fruits. I got my herbal botanicals here. Kidneys are not flushing right now because they've stopped me up with toxic chemicals. I was a dropout just last week. So a lot of detox that I'm going to go through on my journey back from the multi-billion-dollar industry that we call the cancer health system. Talk to you soon. And you know my name's Margarita. I'm going to talk to you again.